So good morning, my name is Jane Dorlin Vargas. Today we are going to talk about psychological disorders. The psychological disorders are anxiety, depression, schizophrenia, violence, misunderstood, homeless, different of offering, and drugs. We have also mood disorders, for example, and mental illness. For example, bipolar disorders, minor depression, major depression, prior suicide attempts, specific phobias, obsessive compulsive disorders, schizophrenia, eating disorders, panic disorders, autism, spectrum disorders. But first of all, let's talk about what mood is. It's when a person has a positive and negative feelings and presents in a daily experience. For example, happiness, sadness, fear, anger, upset, worry, embarrassment, proud. And now, what a disorder is. It's a psychological problem in which the person's mood heavily influence his or her perception and cognitive process and consequently behavior. But now let's talk about the classification of mood disorders. So we have bipolar disorders, that we have bipolar 1, bipolar 2, schizophrenic disorders, and we have depressive disorders. But which are the mood causes? The mood causes are genetical, serotonin, dopamine, norepinephrine. But let's talk about now for mood disorders. The mood disorders is, we have two different disorders. We have minor and major disorders. And now we are going to talk about depression. What are the depression causes? They are genetics, brain chemistry imbalance, poor nutrition, physical health issue, drugs, and stress. And now let's talk about minor depression. The minor depression has some symptoms like lack of appetite, lack of interest of daily activities, problem with sleep, irritability, children become aggressive. We have also the major depression. So depression symptoms of low mood, changes in appetite, sleep disturbance, agitation, fatigue, difficult concentration, and it's really serious because it's when the people stay sleeping the whole day and stop eating for days, and also gaining weight, lack of sex, attraction, suicide attempts. In men, it presents a violent attempts, and for women, it's passive violence. For example, they cut veins or they are taking pills. So we have also bipolar disorders. The bipolar disorder, it has two poles, the positive and negative. The euphoria, it is a severe mental health condition that it requires inpatient treatment to address life-threatening. Bipolar treatments are raised. We have the type of bipolar. We have disorder, depressive, hypomanic, maniac, mixed causes. And also are substance abuse, stress, sleep deprivation, and trauma. We also have bipolar 1 versus bipolar 2. The bipolar 2 is characterized by hyponia, will never indicate such as psychotic symptoms. It can be treated with psychotherapy or cognitive behavioral therapy in addition to prescribed drugs. We have also some conclusions about mood disorders. The mood disorders are chronic and recurrent disorders. Mood disorders are common. Many people suffer needless because their mood disorder is not diagnosed and treated. Diagnostic mood disorders is straightforward. Drugs are effective and practical. Doctors should take the lead in recognizing treating mood disorders. And thank you very much for your attention. Bye.